All right. Thank you so much for joining us today for the virtual Ask a Doc booth for Take Steps. My name is Emily Richter. I am the Executive Director for the Alabama and Northwest Florida chapter of the Crohn's and Colitis Foundation. With me today is Dr. Robert Loudon from Gastro Health. Ask a Doc for Take Steps in Birmingham is sponsored by Gastro Health, formerly Southeast Gastro, here in Birmingham. Thank you, Dr. Loudon, for making time today.
Oh, you're welcome. Thank you, Emily. Happy to do it.
Absolutely. All right. So today we are going to focus mostly on COVID-19. That was most of the questions that we got, some of the commonly asked questions we've been getting throughout the last couple of months. So we will dive right in. To start with, let's clarify just some background information. Can you clarify what the term immunocompromised means?
Sure. That just means that you have an impaired immune system for some reason.
Okay. And that could be because of IBD or because of a biologic medication or other medication?
So it's not entirely clear that just having inflammatory bowel disease causes you to be in an immunocompromised state. However, it's very clear that many of the medications that we use, such as biologics, methotrexate, azathioprine, prednisone, certainly those do cause immune suppression.
Yeah, absolutely. So many IBD patients are on those medications that you listed that would suppress their immune system to treat their IBD. And we get a lot of patients asking us, should I stay on my medication? So what sort of advice would you offer for those patients who are really worried about staying on their medication?
Yes, we get that a lot too. And generally speaking, the benefits of staying on the medications almost always outweigh the risks of stopping the medications. Inflammatory bowel disease is characterized by an overactive immune system, which causes damage to the GI tract. And the medications that we use are suppressing that overactive immune reaction, and they allow the gut to heal. So if those medicines are stopped, that can lead to worsening symptoms or a flare of your inflammatory bowel disease. And then that can lead to having to take prednisone, to malnutrition, to being hospitalized, which are all certainly worse than staying on the medications to begin with. Now, the caveat to that would be is if you've been diagnosed with COVID-19, then you definitely need to contact your gastroenterologist and talk with them about that.
Absolutely. Would you say that there are any other exceptions to that advice?
Well, there is some data that is indicating that prednisone can lead to worse outcomes in IBD patients who are infected with COVID-19. And so the recommendations right now are certainly to speak to your gastroenterologist about possibly tapering your prednisone or coming off of that if that is possible.
Gotcha.
And currently, Gastro Health, as I'm guessing other offices, are offering both traditional office visits as well as telehealth visits to try to accommodate as many patients as safely as possible.
Gotcha. Absolutely. So how should your loved ones behave around you at this time if you are on one of those medications? Just wearing masks or social distancing, or should they avoid contact completely?
Yeah, I don't think you have to avoid contact completely. I mean, you certainly want to know if a family member or friend has symptoms suggestive of COVID-19, you should avoid them. However, generally we just recommend you follow the CDC guidelines for social distancing. You should wear a mask when you're in public situations or group situations, possibly, and definitely follow the guidelines for hand washing and sanitizing surfaces and things like that.
Absolutely. So another question that we get a lot is about going into an infusion center. A lot of patients are on infusion therapies and they're concerned about social distancing and safety. Can you talk about some of those things that might be going on in infusion centers and whether it's safe?
Sure. So we would encourage all patients who are getting infusions to continue to get their infusions. unless you were having symptoms suggestive of COVID-19, then we would not want you to come. But at Gastro Health, we have a very rigorous screening process where all patients, staff, visitors are screened for symptoms. We take temperatures. We have spacing of the chairs for the infusion. We practice physical distancing. All staff and all patients are required to wear masks. And so we think it's a very safe situation and would encourage people to continue getting their infusions.
Absolutely. And what about folks who don't go to Gastro Health? How can they make sure that their centers are keeping a safe distance and doing all the things that you mentioned?
Yeah, I think the best thing would just be to contact your infusion center and ask them what are they doing, what protocols have they implemented, and if there's any questions or concerns about a specific infusion center, don't hesitate to call your gastroenterologist for more information.
Absolutely. So several people have shared with us that they've postponed colonoscopies or other elective procedures they might have had scheduled over the last few months. So what advice would you give for folks who are looking at whether or not to reschedule those things?
So when the pandemic initially hit, most health systems did recommend and states recommended delaying elective procedures, and that we did do that. And mainly that was to try to preserve PPE or personal protective equipment. However, now, especially in Alabama, there's no shortage, and so elective procedures are proceeding as scheduled. Our various endoscopy centers, just like our offices and infusion centers, screen patients. We take temperatures. We have social distancing in the waiting rooms. Families of the patients actually stay in the car during procedures, so very safe to get your procedures done. Many times with inflammatory bowel disease, an endoscopy or colonoscopy makes a big difference in management and what direction we're going to go and adjusting of medications. And delaying or putting off a recommended procedure could certainly have adverse outcomes on your health. And so at this point in time, we certainly recommend people go ahead and get their procedures, and we feel it's very safe to do that.
So we know that at least one symptom of COVID-19 can be GI upset, which could be kind of confusing for someone with IBD to distinguish, is this a sign? Should I get tested? So how would you recommend that IBD patients handle if they have some GI symptoms and they're worried about confusing it for COVID-19 or vice versa?
Sure. So about half of patients with COVID-19 will have some GI symptoms, and often it's diarrhea. And of course, that can be confusing for IBD patients. And so if an IBD patient is having diarrhea, but they're also having like fever or respiratory symptoms, then first I would recommend that they get checked for COVID-19. If that's positive, then there are some things we would recommend regarding their medications. Often we will hold medications for a couple of weeks. We might delay an infusion if that's coming up until the symptoms go away. On the other hand, if the test is negative, then we would just proceed as we usually would with working up those symptoms.
Gotcha. So one thing, and I think that this is true for across the board IBD patients, we're always looking for dietary changes or supplements, things we need to be doing outside of our regular regimen to stay healthy. Are there any of those that might, help with COVID-19 at all?
There's really just not any information about that at this time at all. And, I would just probably dissuade people from, grabbing supplements or vitamins to try to prevent COVID infection. There's just no data at this time that any of those would be helpful. And occasionally you might get into something that could actually cause some problems.
Absolutely. So we also wanted to share, and we were hoping you could give us a little bit of background on the COVID-19 Secure IBD database. It's a resource where data is collected about COVID-19 and IBD specifically. Could you tell us a little bit about it and kind of how they're tracking things, how cases are reported?
Sure, that's an international database that is looking at IBD patients who have documented positive COVID-19 tests. Any physician in the world actually can submit a patient to the database, and as last I looked, there was over 500 patients in the database, and they're looking at things like to try to define the impact of COVID-19 on IBD patients and determine how factors such as age, comorbidities, IBD treatments might affect COVID outcomes. And the initial data, which has just come out in a paper that will be published, suggests encouragingly that most IBD patients aren't at much increased risk compared to the general population. Um, just like the general population, the risks of age and comorbidities are the most important factors, other than, as I mentioned earlier, the use of steroids. Encouragingly, the use of tumor necrosis factor agents or biologics does not seem to be associated with an increased risk of a poor outcome with COVID. So that's encouraging. So we'll continue to watch that.
Yeah, that's very encouraging news. I know a significant portion of our patients are on biologic therapies, so that is definitely somewhat reassuring. So I think that is almost all of our questions. Did you have any last thoughts that you wanted to share with everyone?
Well, all the information about COVID-19 is changing very rapidly, as we all know. One day we see something, the next day we see something else. But I want to encourage people that, as I said, the initial data is very reassuring that IBD patients don't seem to be at increased risk of COVID-19 or a poor outcome if they get COVID-19 when they're on standard therapies. And so we all just always want to remember simple things like eating a healthy diet, getting plenty of rest, exercise, stress management. Those kind of things can just help to maintain your immune system, and follow the recommendations for social distancing and mask wearing and hand washing. And don't hesitate to contact us or your gastroenterologist if you have any questions or concerns.
Wonderful. Well, Dr. Loudon, thank you so much for making time, and thank you to GastroHealth for sponsoring our Ask a Doc booth virtually this year. If you have any other questions, you can always reach out to us at the Crohn's and Colitis Foundation at info@crohnscolitisfoundation.org, or to GastroHealth. Of course, Dr. Loudon would be happy to field any of those questions by calling their office. Thank you so much.
You're welcome, Emily. Thank you.